Thank you, Ceann Comhairle. Tánaiste, Minister James Riley is assuring everybody that the health service is getting better, that waiting lists are getting shorter, and he assures us that patients who are waiting the longest for treatment are in fact being treated. Unfortunately, Tánaiste, the facts and the figures confirm that since taking office, the actual number of adults waiting for surgery in the country's hospitals has actually increased by a dramatic 40%. The latest figures show that there were 13,435 adults waiting longer than 6 months at the end of March, which is a damning indictment of the stewardship of Minister Riley. There are now more patients waiting for treatment over 6 months, over 8 months, over 9 months. Now, the Department of Health, when it was contacted in relation to this situation, have confirmed and say that it's due to severe pressures on emergency departments. Although this is another area which Minister Riley recently said is under control and getting better. And on the ground, the reality is that nothing could be further from the truth. For example, in the last 3 weeks alone, all elective surgery, except for paediatrics, has been postponed in Cork University Hospital. There's a daily email going out in that hospital, out to the wards, telling them to cancel all elective surgery. Now, this includes cardiac, orthopaedic and neurosurgery. And the most shocking of all, it includes cases for the treatment of cancers. Now, consultants inform me that it is practically impossible to plan any elective surgery as the accident and emergency department is so busy. That hospital is finding it extremely hard to cope. There are 3 wards closed in that hospital alone. There are 84 wards closed across the country's public hospitals. And yesterday, there was 408 patients on trolleys in A&Es across the health system. And yet again, this is an area that Minister Riley says is under control. I would ask you, Tánaiste, is Minister Riley in denial? Is he living in some fantasy land? And would you accept that there are now severe issues facing the health service and that the centre within the health service can no longer hold? We now have 2,277 public beds closed in the health service. And elective surgery now, even in cancer cases, is being postponed as a result. Those are not my figures. Those are the figures from the INMO, the Irish Nurses and Midwives Organisation, which Minister Riley, when he came into office, said he would accept those as the official figures in terms of trolley count, bed closures, and so forth. So I want to put it to you, Tánaiste, would you acknowledge that the health service now is under an extraordinary strain and requires dramatic intervention by government to arrest the crumbling across the board of all aspects of the service it attempts to provide?
Thank you. Tánaiste.
Well, first of all, can I say that the priority of the government has been from the very beginning to unblock access and to improve the flow of patients, because the patient is our #1 priority. As set out in the programme for government, the Minister for Health established a special delivery unit immediately on foot of the government being elected. The aim of the special delivery unit is to unblock access to acute services by improving the flow of patients through the system. The government's commitment to improving access is clear, and it's in part of that is the reform of the hospital services. I think it's important that we're clear about the facts here. There has been a figure of 13,435 adults waiting for a planned procedure. That was quoted in the media, and Deputy Martin repeated it again this morning. I'm informed that that figure is incorrect. The actual figure that I have is 10,002 at the end of March, and that's published on the ntpf.ie website. Now, that is an increase on March 2011. It's an increase of 4%, not 40%, as you have alleged. However, it's not I think you also have to take into account, when you're looking at these numbers, not just the numbers who are on the list, but the period of time that they are waiting. And in March 2013, the median waiting time was 2.4 months, which was down from 3 months in March 2011. I might also mention that in July 2011, when the Special Delivery Unit was set up, there were a total of 6,277 patients who were waiting for more than 9 months for inpatient or day case treatment, and that was a legacy left by your government. By December last, there were just 109 patients who were waiting for longer than 9 months, and that is an achievement I think that ought to be acknowledged. However, we're not complacent. The progress does not mean that the problem has been solved. You asked me, is the health service under strain? The health service is always under strain. And what we are doing is addressing that strain, getting the length of time that people are waiting down, dealing with the situation on the ground. There has been an increase in the number of people presenting at emergency departments over the past couple of months. That, as Deputy Martin will know, is a seasonal phenomenon, and it is something that Minister Riley and the HSE are working to get at.
Thank you. Tánaiste.
First of all, could I put it to the Tánaiste that the first thing the Minister did when he came into office was to change the target groups. The internationally recognised targets for waiting lists was 3 months and 6 months. And he unilaterally said it's 12 months. He did that to massage the figures and to perpetrate a contract. That's what he did. Now, the SDU has refined his machinations to 9 months and over. And the reality is, the actual figures for 3 months and over and 6 months and over have rocketed over the last 2 years. And the issue in relation to trolley count over the last number of weeks has also rocketed. And there is a fundamental problem. It's more than just the service being stretched. I mean, you haven't commented at all on the reality that there's an email going around in a major acute tertiary hospital telling consultants and telling the wards not to do elective surgery. Now, elective surgery is life-saving surgery in terms of cardiac, in terms of neurosurgery, in terms of cancer. Well, it's unacceptable. It's unacceptable that should be happening. And there's a further 750 million lined up for cuts this year to the health service. I'm saying to you, I don't think the centre can hold within the health service.
Thank you.
The health insurance is unravelling, with thousands leaving every single week because of the situation there.
Thanks, Deputy.
The public hospital system cannot cope with the demand. This is what consultants, nurses and people on the ground are telling us. And I think it's important.
Deputy, would you put your question,
aside the
please?
spin
You're over time.
And all of that, and acknowledge that a dramatic intervention is needed by government to stand back from this, assess the crisis, and then work out a proper pathway to resolving it and ensuring that at a minimum, in what are difficult times, to provide a basic health service to our public and to ensure that operations that are needed are carried out for patients.